We're about halfway through our discussion here. I'm going to let Catherine bring up the next question. There are a lot of topics that we in advance talked about that are obvious, that are important. I'm going to let you pick what you think, Catherine, at this stage you'd like to ask in terms of a topic.
Sure. Obviously, healthcare and access to quality, affordable healthcare is a major issue. Here in Texas, 25% of Texans lack health insurance, and they have to either forego medical care they need or they wind up in the emergency room, which just passes the cost on to county taxpayers to the tune of $9.2 billion in 2005 alone. Many of the uninsured are working families whose jobs do not provide adequate insurance or any insurance, and they're not poor enough to qualify for social programs such as Medicaid. How do you propose these people access needed health care before they end up in the emergency room?
Let me let Mr. Dale answer first here on this one.
Well, you know, that's something that we actually struggle with in Williamson County. We've got a lot of residents that are, you know, indigent is the word that's used in terms of not being able to afford medical care. The burden does fall onto the county, and some of that slack is picked up at the county level. There are also charitable organizations. I think it's an issue that you have to look at when you're thinking about the federal government and federal health care coming down, understanding what all the rules are. We do lack insurance for some people here in the state of Texas, and it's a real problem. I'm not sure that the solution that we're seeing at the federal level is the answer, and it's going to have to be addressed. It's going to take money, no doubt, but it also has to go towards preventative care as well to try and make sure that people are getting to the doctor early before they're getting chronic problems.
Mr. Stillwell.
I believe that expanding Medicaid, as the Affordable Care Act prescribes, would be a good thing for Texas to do. That 26% of the population that's uninsured is the highest in the nation. That's unacceptable. Texas should do better than that. We should not be satisfied with having a population that does not have access or can afford health care. It is much cheaper to keep people healthy than it is to treat them when they're sick. And when you're talking about somebody who's indigent who can't pay either way, the taxpayers are going to pick up the charge one way or the other. So it would be much cheaper to get these people on the health insurance rolls if we expanded Medicaid, and it would drop that uninsured rate by about half if we were ambitious and aggressive about doing it. You know, I own an insurance agency, and I can sell just about every type of insurance, and I don't sell health insurance by choice. It's a broken system. It doesn't work. I think all sides will agree that it's a broken system. We just have different solutions on what should be done to fix it.